more. Welcome back. We're continuing on, and now we're going to talk about Remarkable Care 101, which we're going to break down in a later segment into much bigger sort of concept. But Remarkable Care 101 is the very, very, very basics of sort of a three-part interlude that happens every time you deliver remarkable care. And so remarkable care is not just for clinicians, it is not just for care providers, it's for everybody. It is a cultural way to be. And again, the idea here is that remarkable care is something that's heartfelt, and the intention behind it is to genuinely care. But we're going to give you tools that will help you sort of be reminders to what this is all about, and also to help define it and give examples so that you can then build from it. So Remarkable Care 101 is about the sort of the three main steps of delivering remarkable care. So the first is sort of the preparation, the beginning step, and then it's that big meaty step where you go in and you do whatever you're doing and provide remarkable care at a visit, or when you're working in the office, or wherever it is that you're delivering what your value is into the work you're doing. And then there is the last step of completion. So the first step in this case is that you always want to come into a situation, whether you're in the office or whether you're out in the community, you want to, or you answer a phone, right? Every interaction with a patient, with a family, with a referral source, with an employee, a team member, anyone, as a person who's part of Illume, in your job, the first thing you want to do is begin with a warm, sincere greeting. Okay? A warm, sincere greeting, and you use the person's name. So a warm, sincere greeting is not, hi. It's, hi, how are you? How are you feeling today? What's going on for you? It doesn't mean you have to spend 10 minutes, by the way. It can be very short and sweet. This isn't about spending a lot of time. It's about genuine focus on the other person that can be 5 seconds long. But that genuine connection is important because you're building trust. You're telling the person you care. You want to create a communication that says, I'm happy to see you. I'm grateful that you're here. I appreciate the opportunity to be with you. That's what this first step is about. And as we go into the more of the Remarkable Care Boot Camp, we talk about the 10 steps of remarkable care. The first few steps are about teeing this up, really. But the basics are you are connecting with somebody in a way that communicates, I value you, I appreciate you, I care about you, and I'm giving you my 30 seconds of a greeting to say hello. Then the next step of remarkable care is anticipation and fulfillment of a person's needs. Okay? And so this is where, as a clinician, you would have studied whatever is in the care plan. You know whatever those clinical, physical needs are. But you also, beyond that, you anticipate and try to fulfill as best you can all the other needs and expectations of the person in a way that would communicate that you genuinely care. Just the way that I talked about my grandmother and her simple ways of wrapping me in an Afghan and putting on the television show that she knew I would like, and wrapping her arm around me in a way that was comforting, and giving me cookies, which she knew that I would appreciate and love, with milk to dunk them in, and to just listen and be there with me. So there's that anticipation and fulfillment of the person's needs is all of that. And if you're in the office or you're doing something that's not patient related, it behooves you to see how you are providing care through the work that you're doing, whether you're providing quality assurance, or you're doing some kind of documentation, or you're balancing the budget, or you are doing interviews. right? For whatever part of the company you're in, you're anticipating and fulfilling a person's needs by your interactions and by whatever it is, the task at hand. The task is always focused on fulfillment of needs. Put that intention behind whatever you're doing. You're not just taking an action, you're fulfilling a need. You're participating in a bigger program that's helping us grow as a company and to fulfill our mission of surrounding others with remarkable care. All right, and then the last piece here is a fond farewell. And the fond farewell is important, and especially when you're in a home, and we'll talk more about this later in the boot camp section, but the fond farewell is about completion and saying goodbye and tying things up. It's a short process, but it's also ending whatever's at the end of the day, putting things back into order, being respectful about how you leave your space, whatever space that you're working on, whether it's in the office, you're in with a patient, wherever you are, you're taking care to put things back into order, and then you say a fond farewell to whoever is around you in a way that is appreciated by the person. So if you are in a home and you're saying goodbye and it's the middle of the night and your patient is sleeping, you probably are not going to wake them up to say goodbye, I'm leaving, but you might gently put your hand on their shoulder and just honor them and say goodbye. I wish you well. So even though they don't even hear it, your intention of remarkable care is there. Or if you're in the office and you're leaving and you see the person, that other people in the office are busy, you don't need to interrupt them. You're anticipating their wants and needs. You can just simply give a little wave, but it acknowledges that you're going, and it gives sort of a completion, right, to your day. It's important in all these circumstances to use people's names. Okay, this is customer service 101. Okay, use people's names. They need to be heard. They love to hear their name, right? Everybody loves to hear their name. When you're interacting with new employees, especially, it's important to get to know their name, use their names. If you're interacting with patients, by all means, use their names. Don't just talk around them, speak using their names. If it's somebody that's older than you, it's a good idea to use Mr. and Mrs. unless they've asked you not to. If you're taking care of a patient in a home, and be respectful, call them Mr. or Mrs. Brown, and use their name in that gentle way. So this is just, again, I hope you're hearing that there's the mechanics behind remarkable care, which is say hi, have a nice greeting, use their name, fulfill their needs, say goodbye. That's the structure behind remarkable care, but the intention behind it is to say, I care, I appreciate, I am genuinely invested in doing what's right for you. All right, so that's what Remarkable Care 101 is all about, those 3 steps. Next, we're going to talk about our guiding principles. Okay, the guiding principles of Illume basically explains how we approach our business, how we approach growing, and how we approach the way we want to, what in business terms would be said, go to market. So these are the principles we use when thinking about how to grow, how to focus. So we have 3 different principles. The first one is curated focus. The second is informed innovation. And the third is wise community. Okay, so let me break these down for you. So the way that it works is we surround patients with remarkable care. So we first need to focus. Okay, so first we want to focus. And so the way that we curate or focus is we look for a population that is underserved in some way. So this continuous care population is one that in Connecticut in particular is underserved. It's underserved because a lot of agencies don't want to take it on. And the reason they don't want to take them on, and I'm going to tell you the truth, The reason they don't want to take it on is because it's complex, it's filled with risk. It means that the people you're taking care of, medically fragile people who need really good care. It's also a big part of why it's not popular to take on is because the majority of continuous care patients are, their source of funding is Medicaid. And Medicaid, just so you're very aware, is the lowest paying of all the billing or payers. So, hold on a second. So this is important for you to understand because there's a real ceiling to how much is paid on this. And Medicaid, by the way, has not increased its rate in 12 years. All right. So even though cost of living has gone up, even though the cost of care has gone up, Medicaid has not increased its rates. And truthfully, the reality is they're not going to. We're hoping that they don't bring the rate down, cut the rates. And it's connected to a much bigger problem, which is that there are 10,000 people every day in this country turning 65. And so there's more and more people who need care, and there are not growing dollars, right? Because our population is such that people are getting older and there's not as many young people to pay for the older people. So it is a real challenge. So as a result, in the state of Connecticut and really throughout the country, but in Connecticut in particular, continuous care is underserved, and it's largely underserved because agencies don't want to deal with Medicaid at the level and the volume that we as a company, Illume, have chosen to do so. Now, this means that we take on that responsibility of both the risk of having medically fragile people and the risk of having Medicaid, which is the lowest payer source, which means that we have to really lean on our second guiding principle, okay, which is informed innovation. All right, so our approach is first just find an area of care that we want to curate and we want to get to know and we want to make sure we're really good at it, which is what that curated focus is all about. And then it says here we study the many patient needs, which is true. We need to study the needs. We need to study how the process works, that we align with a family, and how it works that we build a team around that family, and how we communicate with each other. How does the team who's in the home, the nurses providing the care, the shift nurses, how do those shift nurses communicate back to the supervisors, and how do those supervisors then interact with the office to make sure that all together we're interacting? So this is all a big bucket of needs, right? So we study all of this, and then we used informed innovation to actually create innovative solutions. All right, so we develop our services in a particular way. We develop the way we onboard patients. We develop the way we train our team, all of you. We develop the way we develop curated care plans. So our plans are more than just the typical the typical physical needs, medical needs, but really look beyond that. What are the psychosocial? What are the other needs of a family? But we also have to look at how do we do this financially? How do we build a team that works financially? How do we meet the regulations and the supervision requirements given to us by the Department of Public Health and Center for Medicare and Medicaid, CMS? How do we do that and provide remarkable care? That's where the innovation comes in, and that's where we all have to be willing to learn and grow. Remember that? Learning and growing is being part of our core values. So the way we do this, in order for us to be able to be sustainable as an organization, we have to curate, we have to do things in a different way. You'll find that we do a lot of videos, we do a lot of workshops, we do that kind of thing because we are trying to curate a way of doing this so that our patients are really well cared for, our employees feel cared for, and the company itself can sustain. So that's what what the informed innovation is all about. We're also very data driven, and that innovation comes from the data that we we study, we look at all kinds of data, from quality metrics to how many hours, and capacity metrics to financial metrics to recruiting and onboarding metrics to retention metrics to how many call outs we have in a given month, for example. We look at all of this because it reflects back and helps us know how we're doing and what we need to tweak in order to create a value to our families that's safe and remarkable. And then the final piece here is the WISE community. And the WISE community is the way that we attempt to share what we've learned, and to have community be part of how we plan, measure, and improve. So it has to do with the way our operations work, a way our team works, the way that we want you to work with your teams for each care team, how we want you to partner with your care manager, your case manager, and the other nurses caring for, and the home health aides caring for a particular patient, or PT, OT, whoever's involved, all gathering around and planning, measuring, and improving what you're doing all the time. And that's this WISE community, working together, teaching each other, training each other. It also has to do with our financial management and the way we look at our numbers and make sure that we're healthy. We have to make sure that we are ready for potential risks like Medicaid dropping its rate. That's a risk. Medicaid did drop its rate last year, actually. In 2017, they removed several different add-on fees that they used to pay to agencies like ours. And it put many agencies in peril because they were not prepared for it. And really, nobody can be fully prepared for it. But we as a company and together as a team, we have to be ready for that. So together we look at how we plan, measure, and improve all the time. And so when we're measuring and we're planning and we're sharing how things are going, understand that it's part of our bigger guiding principles. Again, the curated focus helps us decide who to focus on, and we want to focus on populations that really are underserved and have a particular degree of need, and then we want to study those needs in a really deep and ongoing way. And then we have this informed innovation piece where we continuously are looking to improve and make things better, reach deeper into ourselves for how we can be smarter and more efficient and increase the remarkability, and at the same time lower cost. I know, sounds crazy and difficult, but it's reality. It's the truth of what our situation is in these times. And then finally is the WISE community is using each other to continuously improve, to plan and measure and innovate. So that's what our guiding principles are all about. And so I want you to stop now. We're going to take a quick quiz on what our guiding principles are all about.